I'm Dr. Benedict Peng. I'm a consultant orthopaedic and spine surgeon. I'm from Island Orthopaedic Consultants. I do general orthopedics, but my subspecialty is spine surgery. The conditions that I do are mainly spine degenerative disease, spine deformity, tumor, trauma, and infection. Keyhole incisions, and to treat patients through small incisions. This allows them to go home more quickly, less pain, faster recovery, and shorter hospitalization. My most challenging case so far was a 85-year-old lady who slipped and fell and fractured her spine. It was particularly challenging because she was old and she had a lot of medical problems. She had heart condition, diabetes, and high blood pressure. This makes doing any surgery for her very risky. But we need to do surgery for her because otherwise she may become paralyzed. I overcame the challenge by doing her surgery minimally invasive, whereby I did keyhole incision to free the nerve and as well as treat her fracture. She made a very rapid recovery and was able to walk the next day. Proudest moment of my profession was a case of a young man who was in Phuket and he was playing a banana boat, and the banana boat hit a wave and he was tossed out of the banana boat and he hit his neck and head against the banana boat, and he sustained a fracture dislocation of the neck and was paralyzed. So he was flown back to Singapore from Phuket, and I had to do an emergency operation for him, and I had to free his nerves and as well as to fix his fracture. He made a very slow but steady recovery, and after a few months he was able to walk. The quote that I live by is to cure sometimes, but to care always. This means that it's not always that we are able to cure a patient, but we should always give them the best care and comfort all the time.